Hello, everyone. My name is Gwendolyn Bork. I am the president of Focus for our community unity and support. We are the Lancaster Depew Addiction Prevention Coalition, and we are continuing on in our addiction prevention series, Addiction Prevention 101. And for this month, we are focusing on planning. So what I'd like to do is I'm going to share my screen and go to our website. On our website at forourcommunitytoday.org, and you go into the events section, it tells you exactly the outline of our 2021 to 2022 addiction prevention series schedule. So we, at every single monthly meeting, which is always the second Tuesday of the month, we are using our partners, the Western York Addiction Prevention Resource Center, and they're providing more of the top level education on addiction prevention work. Okay, so they give the overview of what we're doing as an addiction coalition, the structure that we follow, the training that we all use and serve for community level change. And then at the very end of the month, I launch a more kind of bottom up approach, a more individualized education as it pertains to focus specifically. So this past month, we were talking about planning. It is part one of a two-part education series in this regard. And this month, we're going to be talking about really the overview, developing the strategic approach that includes policies, programs, practices, creating a logical, data-driven plan to address problems that are identified. And with that being said, if you were to go again to our website and you were to click on the research tab, then prevention, okay, what did I say? Prevention science. This little box right here, these are two boxes that will connect you to two different websites. One will take you to our state office for addiction and alcohol prevention. It's called SAMHSA. And this little box right here will actually take you to here, which is a complete overview on the training that we're provided as addiction prevention specialists that has been gathered by CADCA. Okay, so the Community Anti-Drug Coalitions of America, they work with the NIH, they work with the National Institute of Drug Abuse, they work with all the federal department heads to guide us, the CDC, to help guide us on the models that we use that are effective and will create population level change. So you can click right on that and go right to this box, and this is where we're going to go. So hold on one second. I just want to make sure that this will open up and you can see this. Okay. So what we're going to do is we're going to look at just really the models that they use, right? So this is the Coalition Impact Environmental Prevention Strategies, Community Anti-Drug Coalitions of America. That's who trains us. And what I'd like to go over, just laying the foundation for community change. So the public health model, the Institute of Medicine model, using planning approach for coalitions, a broader look at policy, organizational structure, and environmental strategies. Because then next month we'll get into really the nitty gritty. What is a logic model? What are our root causes, our local conditions? How do we support these types of things that we want to do based off of data that we've collected? So if we go to page 4 of this very important document, it just talks about really the beyond the basics. So this publication launches a new series, Beyond the Basics, and it's 4 coalitions that are working in conjunction with the Institute's popular primer series. So it's based on Substance Abuse and Mental Health Services Administration, so SAMHSA, and the Strategic Prevention Framework. This is what we've been talking about since we started this series. It helps our coalition with planning, implementing environmental strategies, And but it doesn't provide a set design for any individual community or coalition. So this is the foundation that we follow, that we kind of keep in mind as we again dive into the more specifics. So those very attuned specifics will come into place in our next session. So planning part 2, we'll call it. So environmental strategies, this is again kind of a piece of what we do, and it's effective for long-term outcomes. And these address well-accepted prevention approaches that coalitions use to change the environment in which substance use and abuse occur. And we've had a lot of discussions about that. We use them all the time. Here's a couple different, publications that you look at, but the root of environmental approaches, its interest in the scientific study of environmental strategies and the corresponding use of alcohol policy dates back to the mid-1970s. So the United States, this approach was embraced in the 80s by communities looking for mechanisms to address the growing problems of alcohol, outlet-related crime and violence, drinking and driving, underage access to alcohol, and other community-based problems. So they really directed their attention to providing a foundation that offers evidence-based strategies that communities and local municipalities could develop to reduce these problems. They have ones from the WHO from 1975 called Alcohol Control Policies, another one by the WHO, Alcohol Policy and Public Good, and another one on alcohol in 2003, Alcohol, No Ordinary Commodity Research and Public Policy. So they basically started these strategies in the 70s to try to come up with ample evidence that would create policies, local, state, and national, that reduces these population level issues, right? And one thing that they really did is they tried to look at, how do you target the individual and how do you target the environment? So an individual, you've got the family, you've got school, you have healthcare providers, you have faith community, all of those things touch the individual. And then if you look at just the environment, it's got, the types of regulations that are happening, availability, access to these types of drugs and substances, and then how a community is, the normalness of a community, what they think, what they perceive, what the kids think, what the parents think, what the community at large, has developed as a normal pattern. And that touches all the youth. So there's 2 attempts at providing these prevention strategies that alter these kinds of environment. And with us, I was hoping that maybe we could get into it. There's the public health model, where they're looking at what is the agent, what is happening in this particular type of person, the host. So the agent would be, a drug or a substance, and the environment is where the host, where this person is, the individual, the person using. So here's their example. You have alcohol, you got the individual, and then you have physical and social context. So we're looking at, when we plan, we look at, okay, what is the public health model? The model that demonstrates how problems arise through relationships, interactions among an agent, a substance or drug, a host, an individual drinker or drug user, and the environment, right? The social and physical context of that use. They've been looking at this since, 1964, when, tobacco was a big problem, and they created these education and cessation programs. They implemented these changes, and, they're groundbreaking smoke-free policies that were implemented on a part of that, which now today many states and localities have enacted in enforcing clean air laws. What we're going to notice now is that with the implementation of non-medical marijuana, we have to look at these clean air laws and with marijuana use now, are they going by the same guide as these Clean Air Acts? And unfortunately, we're noticing they're not. They're less strict. So public policy, zoning, things like that. We're going to be looking at things in that regard. So that's the public health model, right? So it's like it takes a very defined look at what's happening, what kind of drugs are or substances are the problem, who's the host, who's being affected, and what's the environment. And that's what we do look at. We take surveys. We surveyed our Lancaster and Depew students, 8th, 10th, and 12th grade students. Our host was specifically those students. The agent, we looked at we surveyed all the different types of drugs and substances that they may be affected by. And then the particular environment, well, we're looking at all those things that, are up here in this little model, which is why these people are a part and have a sector, as they have a stakeholder seat at our table. We have parents, we have the parent sector, we have the education sector, we have healthcare providers as a sector, we have faith-based as a sector. All those sectors have a seat at the table because they all have to do with influencing the individual. What is our main goal, though? Our main goal really is, population level change. So if you look at the medicine model, it's divided into, different classifications: universal, selective, and indicative. And, these universal prevention interventions address the general population with programs aimed at delaying substance use and preventing abuse. They're not specifically, participants aren't specifically recruited for the prevention activities. They can include efforts to bring community members together to plan for services and to change norms and laws, reducing the risk factors and promoting a more protective environment. So this is the universal model that is our focus. It is a long-term approach at population level change. We want to integrate all these sectors that do have an effect on the individual, utilize their expertise, utilize their influence on the individual to help them, to support them, to promote a more protective environment, reduce those risk factors. But it's like with us, we are the hub. We are the ones in the middle that are utilizing each of these sectors as we need them to create that long-lasting population level change. With the selective prevention interventions, it targets subgroups that are believed to be at greater risk for substance use than others. So these risk groups may be identified on the basis of biological, psychological, social, or environmental risk factors known to be associated with substance use and addiction. Interventions are designed to address the identified risk indicators of the targeted subgroup. Okay, we have our quantitative data, quantity, a lot of quantity when every 2 years we survey our 8th, 10th, and 12th grade students. Well, we need to qualify that data. This past set of data, this research that we collected, we're noticing that although substance use was down, and it was down across the nation, which we're going to figure out why on account of COVID, has that been a factor? It's coincidental that it's down across the board, and this is a global pandemic, so we're going to connect those dots. But we are looking now to qualify some of the data that we saw, which was those who exhibited mental health stress were actually 50% more likely to use substances. And it didn't matter which one. Every single one of them was up, double across the board, compared to those who did not exhibit or admit to those stressors. So this is going to be going into 2022. We're going to look at those subgroups. Okay, the ones that are at risk, the ones that are having these mental health stressors, we're going to look at those types of, students and youth through focus groups and key informant interviews. We're going to talk to the healthcare providers, mental health counselors. We're going to talk to the guidance counselors and key informant interviews to try to understand what are those risk factors that is in this current environment that are affecting our youth, right? So we want to know those risk factors in the environment, social environment, the regular environment at home. We know domestic violence is up with, families, with more people being at home. Parents are stressed. So we're going to look at that. And then we're going to look at the indicated prevention interventions. So we want to target individuals that, well, this is them, they target individuals who exhibit early signs of substance use disorders. What they're referring to, there's a system put into place. It's called ACE scores, adverse childhood experiences. So these are things like trauma that has arose in that child and that student. The social workers and the guidance counselors create this ranking system. They know where this person is at this level. The higher the score, the higher the probability that they'll develop some sort of, substance use disorders or, dropout rates, things like that. So these types of problem behaviors are associated with disorders, including early substance use, school failure, interpersonal social problems, delinquency, other antisocial behaviors. And all these things, though, together create this better look at policy, right? So you have the individual strategies, you have environmental. Individual strategies, they focus on the individual of the behavior, their behavioral change. They focus on the relationship between the individual and the individual and the substance. They look to short-term focus on program development. The individual generally does not participate in decision-making. The individual is the audience. Okay, so these individual strategies, they are a piece of what we do. We utilize our partners to activate those individual strategies. Like, for instance, as we discover this high risk subgroup of our students who are using alcohol and drugs as a way potentially to cope with this current pandemic, this unknown and uncertainty of the future, we want to know what's going on at the home. And can we initiate an individual strategy for the youth and the parents to communicate better? Conflict resolution, what's happening at home? Can we minimize those risk factors? Can we promote factors that will help the individuals at home with their parents or, with their school, right? Then there's the environmental strategies, which is primarily what coalition work is. We focus on policy change. We focus on social, political, and economic context of these problems. We look at long-term focus on policy development. People gain power by acting collectively, and the individual is the advocate. We are here not to do prevention within the schools or prevention in the community and provide all the planning and programming. That's our partner. That's Kids Escaping Drugs. That's the face-to-face program. That's Erie County Prevention Council. They do that. And that's a piece of how we all work together. But people gain power by acting collectively. That's what environmental strategies do. So when we plan, we put that piece into what we do, but we are all working together. Like I said, like that hub, like that wheel rowing, moving in one direction so that our individuals, our youth, they are the advocates. When people come and they ask, well, what can we do, Gwen? Well, we're looking at the community as a whole. We're looking at long-term strategies and policies that have an effect long into the future. So the current marijuana policy, we're looking at zoning, we're looking at how marijuana use could affect Clean Air Acts, and things like that. So there's a bunch of different subgroups and committees you can get involved in to help us. And like I said, this year, the majority of our planning is going to be in trying to figure out and qualify this data that we just received as what is happening with our youth. Why, what has COVID done? Has it affected them? Has it not affected them? How is it at the home? How are the parents? And we're going to look at those stresses, this uncertainty, and really, again, dive into the mental health connections between drug use and substance use with mental health stressors. So that'll be one big piece, because we don't really foresee this not ever affecting our youth moving forward into the future. The damage is done. We see the symptoms of PTSD within our youth. We see how this current pandemic has affected their ability to plan for their future, their ability to feel safe and secure. And with that level of safety and security, that is a major component of adolescent development, to where they will then branch out and go about their future with ease and focus and, with diligence. So all these things have an effect on how we do it. Policy change, as I mentioned, is a big one. It's one of the environmental strategies that we use when we plan. Policies can be formal, informal. It can be within a school. It can be within the police department, local merchants. We're going to be looking at this year, what does, all these retail stores now that are selling very highly potent malt beverages, the SoCo liqueurs and the Fireball malt beverages at the grocery stores. Are they in the back of the store? Is it in the front of the store? How are they kind of watching this, knowing that now that this is full, you got students and youth walking through grocery stores all the time and convenience stores. How are they, really policing that? Are they watching that? Are they looking for that? What are the police seeing as far as, theft? Are they, are the stores even looking for that? Can they account for in their inventory every single one of those malt beverage bottles? Are kids grabbing them off the shelf and just walking out? We don't know that, which is why we're going to look at that, since this became a new thing, in our area. And then DoorDash and Grubhub, we tested even last year. Will DoorDash or Grubhub, who can buy and pick up orders anywhere, liquor stores, convenience stores, you name it, restaurants, will they deliver alcohol to a minor? We found out it with our planning of last year. We tested the process, and Grubhub failed. They delivered alcohol to a minor. So could that policy be, we're working with our legislators and our people in government, who at what government level and what office holds these people accountable? Is it the attorney general? Who is it that we're looking at that? So public policy is really big, as far as, there's big goals and there's small goals, right? As far as even the small goals of zoning and as I mentioned. So enforcement, to the things that we look at, that's always, so enforcement of, these 24/7 zero tolerance policies for kids smoking vapes at school, smoking marijuana at school, edibles, whatever that may be. That's a constant policy that's always overseen. And that's why we work with the school resource officers. And I've equipped them with testing kits to test what's in a vape. And they could test any substance now with the kits that we were able to provide to them with our funding. But overall, it's our organizational structure that helps to execute these strategies, whether it's the public health model and the individual, or our environmental strategies. Knowing the public health model, executing our environmental model, putting them both together, utilizing our partners, because our second goal is to create community collaboration with each of these partners sitting at the table. That's how things get done. So coalitions harness the community's power to make change. We are a well-functioning organization. We engage the residents, law enforcement, schools, not-for-profit organizations, the faith community, youth, and other key groups in tandem to address these community concerns. We're well positioned to ensure sustained action on pervasive community problems. And we contribute to making a difference in creating the political will necessary to influence development and implementation of lasting policy. So what do we do in a nutshell? These environmental strategies, they're cost effective. They're given potential magnitude of change in the community. The community mobilization is central to creating population level change. After the data has been collected and analyzed, we assess our capacity to effectively address these identified problems. And it's important when using these approaches, so that many coalitions have consisted largely of members whose focus have been working with individuals, families, and all their small groups to elicit change in knowledge, skills, and attitudes. Implementing these strategies require different skills, such as community organizing, development, and the involvement of different community sectors. So, overall, the goal of what I wanted to help people understand, and this is just some examples of those, is that we need every single person, right? I wonder if there's all the different people in here, but our organizational structure is all about, getting the right people at the table. It's let's go back to that actually. It is here. It's, it's taking things from, it didn't go, well, this is the actual SAMHSA website, but it's taking all these pieces, that little flower to the left, there's the strategic prevention framework. It's taking each one of those pieces and we're building capacity. If we need more mental health counselors, if we need, which is going to be something we're looking at, this year, working with Spectrum Health and other providers. If we need those people at Tabor, we're going to plan for that capacity going into this year. If we need to look at zoning laws and policy change, right, we're going to make sure that we have the relationships with our police, our law enforcement, the DEA. We just confirmed a new partner with the Erie County Sheriff's Office and their community liaison, Deputy Dan Wood, to help us with these things. So the planning process, it's something that we plan for in advance. It's approved by the federal government through where our grant is being operated out of the White House Office of Drug Control Policy. The CDC actually is the one who manages these deliverables, but we look at that, we enhance the skills of our people, which is what we're trying to do through these addiction prevention series seminars. We provide support to our local community, and we utilize all these pieces to infiltrate into those groups that influence the individual, and we plan for long-term population level change, community level change, and we are targeting Lancaster and Depew. So I hope that you all can see that this is where we're at. This is what we do now, and it's there's a lot of moving parts, and planning is the number one thing that is required of us so that we are effective and we are accountable and we're transparent for that which we are desiring to do, which is to reduce youth substance use and create community collaboration for that population level change. So I appreciate your time. If anybody is interested in working with us, as you can see, there's a lot of different pieces that you can get involved in, from sustainability, working on little small fundraisers for us so that we're self-sufficient once this federal grant is over, to policy change, looking at local laws, looking at larger laws like the DoorDash, Grubhub delivery things, because they're already getting ready to plan in their Uber Eats is already working with Canada right now to deliver marijuana, so, and it's already delivering in, other states that have done this. So it's like, we are always looking forward. We're always trying to be one step ahead, because that is prevention. The number one way to prevent drug use is to not use, right? So that's what we're doing here at Focus. I look forward to all of you that have seen this, that really want to get a hold of us and start working with us on these community objectives. And you could do that simply by just going to our website. If you were to go right to our main website, for our communities today.org, you'll notice you can subscribe to our newsletter, which goes out once a month. It shows you exactly the goals and an action plan that we set for the year for 2022, our community reports, things like that. With Focus TV, our YouTube channel, we have tons of resources available to you that we've collected over the years from our partners here at Kids Escaping Drugs, mental health counselors, and so on. And always, if you are looking to help us be sustainable, we have the ability to be a legacy partner, which helps us is we're in the process of creating the Focus Foundation for Addiction Prevention. And here's the list of just some of our amazing platinum legacy partners and gold partners: Chick-fil-A, Tops, Bank on Buffalo, things like that. So if you want to get involved, go to the contact us page, fill out this quick little form. We'll get a hold of you and set up a meeting to discover what your talents and resources and skills, as well as passion, may be. And we'll put you with a committee, and you'll get going on a directive. So thank you for your time. Look forward to seeing you guys next month. And this